I know that you know your smile is very important to you. What do these smiles say to you? They provide a first impression about the person's personality, mirror how the person feels about him or herself, portray their self-esteem. They also influence their interaction with friends and business associates. Even slightly objectionable dental deformities are easily observable by others and may have a negative effect. This brief presentation will show you various types of spots on teeth, tooth discolorations, and deformities of teeth, and what you can have your dentist do about them. What are considered to be objectionable spots on teeth or disagreeable tooth discolorations? If your teeth have any aesthetic characteristics that have an objectionable appearance to you, they're undoubtedly noticeable to others as well. There are probably methods to improve almost any one of these things we're going to talk about. Let's look at some of the more common discolorations and objectionable spots that occur on teeth, and then I will make some suggestions about improving their appearance. As you observe this patient, you will see many white and yellow spots. They're really dental decay. They're present on this teenager's teeth as caused by inadequate oral hygiene during his orthodontic treatment. They can be reduced or eliminated. You may have seen such superficial white spots as you're now observing. They were caused by excess fluoride during tooth development. A little bit of fluoride is great and reduces decay. A lot of fluoride, you're looking at it. These white spots can be reduced or eliminated. These very obvious white spots were caused by an accident influencing the primary or baby teeth at about 1 to 2 years of age. The trauma negatively influenced the developing permanent tooth bud. They can probably be removed relatively easily and inexpensively. And yes, white spots are often present in adults, previously caused by an accident that pushes the baby teeth into the permanent tooth bud. In this case, the primary baby tooth or primary tooth was traumatized at about 1 to 2 years of age. Although questionable, the white spot can probably be removed. These are very objectionable. Think about them if they were on your child. They're opaque, white, and right in the front of the mouth. They were caused about 1 year of age by an apparent accident pushing the baby teeth into the upper developing permanent tooth buds. A mild acid can probably remove them. You can note the white and yellow tooth surface irregularities in this teenager. The discoloration runs in a line across the teeth. This malformation was caused by a high fever during early permanent tooth development. These malformations probably are not too easy to remove, and they may require some form of veneer or surface covering. I don't have to tell you, these teeth are gray overall. What caused this? Antibiotic delivery from near birth until the teeth were fully formed. The likelihood of removing the color is questionable, and the teeth will probably require, as the last patient, some form of veneer to mask the color. This patient has multicolored teeth. Look at the striation halfway across the tooth. This was caused by antibiotic delivery as a baby from near birth until about 1 year of age. This patient may require, again, some form of veneer or cap or crown to mask the color, but conservative techniques can be tried as well. In the last few images, you've seen the most commonly occurring tooth discolorations or spots, and you may have determined which type of discoloration or tooth spots you have on your own teeth. Your new knowledge and your questions will help your dentist to make some suggestions about the best way to improve the appearance of your teeth. What are the alternatives for removal of objectionable spots or discolorations on teeth? You need to talk to your dentist to determine the cause of your overall tooth discoloration or the spots on your teeth, and to hear what can be done to remove or cover the disfigurations. The following images will show you some of the methods that can be used to overcome your specific aesthetic challenges. Watch them carefully. Remember this patient with the one large white spot right on the front tooth and a defect on the other upper front tooth next to it? Removal of the white spot with a weak acid and simple coverage of the second affected tooth with a little plastic restoration are two of the easiest and least expensive alternatives if they can be done with your situation. This image shows where we have used a little weak acid to take off most of the discoloration. Now watch. Does that look like it's been restored completely? It does. You can't tell one tooth from the other. And the white spot is gone, and the irregularity on the other front tooth is also repaired. You've probably heard of whitening or bleaching of the teeth. It's relatively simple, it's effective, and inexpensive if it can be done in your situation. The overall stains can be related to medications taken by the patient at some time in their life, or just the stains that accumulate from pigmented foods and drinks and smoking and other acts. Look at this group of images. You'll see the beginning where the teeth are quite yellow, and you'll see two levels of whitening. If you continue to use the whitening solution over a period of time, either placed in the dental office or placed at home by you as supervised by the dentist, you may get the teeth exceedingly white. Going too white is not good because the teeth rapidly return to a more human color. I suggest a medium level of whitening, and that will provide for you a more youthful appearance. This may relate to you, and it may not. You saw this patient before. Remember the lines across the teeth? The color and lines were too deep to do whitening on the upper teeth, but that was acceptable for the lower teeth. Plastic coverings, so-called veneers, were placed in one appointment on the upper 6 front teeth at a moderate cost to the patient. As you can easily see, this patient had 2 discolored teeth and minute white spots on several of the upper front teeth. The defects were covered in 2 appointments by ceramic veneers at a moderate to slightly higher cost. This patient has a combination of white spots on several teeth and a significantly dark, dead tooth and a space between the teeth. That could be done either quite conservatively or more radically. Let's look at it for just a second. You can easily see the dark tooth. You can see the white spots that I pointed out with the arrows. And there is a little space on her left side between the big tooth and the smaller tooth. What did we do? Can you figure out what we did? Looks pretty normal, doesn't it? Let's compare it before and after. The whitening of the teeth is obvious. The new crown or cap on the one dark tooth is similarly obvious and very natural compared to the other teeth. And where did the white spots go? They've been taken off with a mild acid. All of that was a moderate cost for the patient and probably could be done to many of you watching this video. Often teeth are so discolored that simple treatment cannot be successful. Look at this patient. Years previously, I had placed caps or crowns on the upper teeth, and you can see they look very good still. Look at the lower teeth though. They are striated, they have 2 colors in, they're yellow, and the only way to satisfy the aesthetic appearance there was to put new crowns on the lower teeth, and you can see the aesthetic result is very, very good, but it's moderately expensive. Now, you've seen a lot of different patients. What are the best alternatives for your clinical situation? As you can probably expect, the methods to improve your appearance range from just a few minutes in the dental office to accomplish and minimal expense to requiring significant time and effort and moderate to high cost. Your dentist will be pleased to provide for you the various alternatives for improvement of the aesthetic appearance of your smile. You now have enough information to ask some educated questions of him or her. Please do so. The aesthetic appearance of the teeth in your smile zone, which is as you smile, clear back into the back part of your mouth, influence far more than just their appearance to observers. Their appearance has been proven to influence your feeling about yourself, your self-esteem, and even your success in your daily work. Make them as normal and beautiful as possible. Talk to your dentist.